Hello, everyone, and welcome to the Oklahoma News Report. I'm Rich Lenz. This week, the Pfizer vaccine became the first coronavirus vaccine to receive full FDA certification. The Moderna and Johnson Johnson vaccines retain their emergency approval for now. Rory Taylor explains why that's important and could lead to schools and businesses ramping up their efforts to make the vaccine mandatory while still allowing for limited provisions to opt out.
And the F.D.A. has given its full and final approval.
The fully approved Pfizer vaccine, now named Comirnaty, upgraded from emergency use authorization to biologics license application.
The FDA-approved vaccine and the EUA authorized vaccine have the same formulation and can be used interchangeably to provide the COVID-19 vaccine series.
Among other things, full authorization means that doctors can prescribe and use the vaccine as they see fit.
This full FDA approval may help give more backing to providers' recommendations when they recommend the vaccine to their patients, and also it may help instill additional confidence amongst those who were possibly on the fence regarding the safety and the efficacy of the vaccines.
The FDA and other doctors do caution against going too far off-label in vaccine prescription, though, especially with youth.
We got a lot of people talking about, doctors asking about, can I go off-label and use the Pfizer vaccine for younger kids? FDA and CDC have come out with a strong recommendation that you don't do that because we don't know what dose of the vaccine will be recommended for that age group.
Comirnaty's authorization comes amid increasing requirements for vaccinations across the nation. New York City announced the same day that COVID vaccines would be required for students and staff in schools. Here in Oklahoma, Integris Hospitals announced this week they'd be mandating vaccination for all staff. The question becomes, who can mandate a vaccine or add one to the current pediatric vaccine schedule with smallpox and mumps? Keith Reed is the deputy director at the State Department of Health.
We are not looking at adding COVID vaccine to the schedule right now. The process for adding a vaccine to the schedule, which is most commonly the childhood immunization schedule used for entry into schools, that requires a combination of approvals through the health department, the legislature, and the governor's office. So there's no one entity that has that particular authority to mandate that.
Currently, Senate Bill 658, the same law banning mask mandates in schools, also prohibits primary or secondary education institutions from requiring a COVID-19 vaccine for attendance or enrollment. However, there is no law preventing the private sector from requiring a COVID vaccination.
A lot of those organizations, especially the larger organizations, they have access to the information they need, and they know what their rights are as far as mandating vaccines. That information has been put out really from the federal level to help assist them with that decision making. And really that's where any vaccine mandates rest right now, is at least for Oklahoma, is within that private sector and those businesses.
That is, aside from those now federally required.
My administration has imposed new vaccine requirements on federal workers, the armed forces, people who work in federal medical facilities, and nursing home workers.
That decision has been challenged by some organizations. The CEO of Care Providers Oklahoma says it could result in staffing shortages if enough nurses refuse to get the vaccination. Citing similar concerns, OU Health has rolled back their vaccination mandates, although many Oklahoma hospital networks do require them as part of terms of employment. Jill McSparran, a nurse with Integris, says staffing shortages are also caused by the healthcare workers overwhelmed by the surge in treating unvaccinated patients.
We're already short on nurses, and now several of my colleagues that I have spoken to are really seriously thinking about retiring early, finding another area of nursing, or finding a new career altogether. I want Oklahomans to know, if they saw what we see every day, they would be in line for the vaccination.
Oklahomans who suffer from compromised immune systems have now been approved to receive a third dose of the mRNA vaccines to increase immune response.
People should talk to their healthcare provider about their medical condition and whether getting this additional dose is appropriate for them, because the patient's clinical team is best positioned to determine the degree of immune compromise and the appropriate timing of the vaccination.
This third shot should not be confused with the Pfizer and Moderna booster doses that should become available to most Americans sometime in the fall. Also this week, Johnson & Johnson recommended a booster shot to reinvigorate a deteriorated immune response 6 months after initial inoculation. But that is pending FDA emergency approval. Rory Taylor, the Oklahoma News Report.
Rory, thank you. This week, a teacher in Grove and an Oklahoma City teenager died from COVID-19. As of Friday afternoon, Oklahoma's death toll is nearing 9,100 people. 1,600 are hospitalized with the virus, the fourth highest total per capita in the nation. And on Friday, Oklahoma City hospitals announced there were no ICU beds available. New cases in the last week averaging more than 2,500 per day, with a total of 22,426 active cases. 42% of Oklahoma's population is fully vaccinated. Oklahoma's college football